keynote. We will hear from Dr. Wanda Lakner about female longevity, a cardiologist perspective. She is working at the SVS and she is a specialist in internal medicine and cardiology and medical director at the Health Center for Self-Employed Persons. Welcome on stage.
Thank you so much, and thank you so much, Erika, for bringing this up. It's really a true honor to be here this afternoon. So, when I got the call from Erika that I should present my favorite heart topic, female longevity from a cardiologist's perspective, and you told me the time slot, I freaked out a little bit, because to condense this vast, complex topic into a nutshell, it's like condensing the universe into a nutshell. So I hope I can fulfill what you're expecting out of this topic. So let's enjoy the next 10 minutes. I will start with a quote of a brilliant woman, Dr. Bernadine Healy. She was a cardiologist herself and the first female NIH director in the US. And she wrote an editorial for one of the most renowned medical journals that we have, the New England Journal of Medicine. And she said, women must present like men or they are not recognized. And she said the cost of ignoring these differences is measured in lives. What did she mean by this? She was talking about women who have cardiovascular disease presenting at emergency units. And she stated that women, if they do not have the typical symptoms that we know men have, get less access to heart catheterization, which you actually need when you have a myocardial infarction. They get less procedures and have worse outcomes. So, when you actually realize when this editorial was written, any guesses out to the audience? What do you think? 5 years ago? Anybody have different numbers? This was written 1991. We're talking about an editorial being published 35 years ago, and it's still as recent as it can be if you read it, this one-pager. We're still discussing the same topics she was discussing in 1991. And what did she make out of this? The Yentl syndrome. Anybody heard of the Yentl syndrome from the audience? Hands up, please. Okay, one person at least. So everybody knows, or many people know the movie Yentl with Barbara Streisand, I guess, right? So now I see nodding. So that's a movie which came out in 1983, based on a book from the 60s. And if you remember, the ones who were watching that movie, it was about a young Jewish woman who had to dress and present like a man in order to get access to her religious studies. So, Dr. Bernadine Healy says it's the same thing in cardiology. Women have to present with male symptoms to get access to proper diagnostics and therapy. And sadly enough, it's still the same case today, but we've come a bit farther than that. So, no reports about female longevity without this insight report from the McKinsey Health Institute and the World Economic Forum, which was published in 2024, about closing the women's health gap. This report actually monetized and made quantifiable in an economic perspective what it means to address the women's health gap. So we all know, as already Professor Müller stated, that women live longer than men. So in Austria we say women live about 5 years longer, but have up to 20 years in poorer health, whereas men have 16 years in poorer health. This graph is not from the report. I can show it as courtesy by Anita Hegge from Norway. You see a man up there and you see a woman up there, and you see the distribution of good health phases during the lifetime of a man and of a woman, and the distribution of poor health. Anything that really comes to your mind when you take a look at this at first sight? What do you think? What did you say? Motherhood, okay. Sorry? Hormones. Okay, motherhood hormones. So, isn't it the thing that comes into our eyes when we take a look at the man that he accumulates bad health towards the end of his life. And we take a look at the female graph. She has times of bad health throughout her whole life. Do you see that? Isn't that striking to actually really visualize and understand that fact? And most importantly, if you take a look at this, you know what these years are. This is the full working period of a woman. So, woman's health has to be seen across the whole life course. It doesn't only accumulate in the end, because women already face different issues when compared to men while they get into puberty and adolescence. So we're talking about menstruation, we're talking about mental health issues, autoimmune diseases, which also are more often in women, severe migraines. Then we get to the reproductive years with pregnancy complications, endometriosis, PMOS, which has just recently been renamed, chronic pain. And then we peak to menopause transition. You said hormones. Yes, hormones are very important. As soon as estrogen leaves us, women get to menopause. They really spike with cardiovascular risks. The vasomotor symptoms that we used to say, oh, there's all hot flushes, you just have to survive and go through it. Those really, if women have hot flushes, this also poses a risk of cardiovascular disease. And at older age, especially cognitive decline, Alzheimer's disease, women are more prone to Alzheimer's disease. So we see that during the life course of a woman, we have different phases that we actually need to address through prevention. So for me, the largest missed opportunity in the women's health gap is cardiovascular disease, because those life years that women spend in bad health, it's primarily cardiovascular disease. It's the #1 killer and the #1 disability reason. So women are less likely to be resuscitated if they have like a myocardial infarction or a cardiac arrest. We have diagnostic delays due to atypical symptoms, which I will also explain later. We have a higher mortality after cardiac interventions, which already Dr. Healy was saying, and women still receive less guideline-directed therapy. So we need sex-specific protocols, and we need to understand that cardiovascular disease is highly modifiable. It's the biggest health span return on investment. And we stick to economy. The report stated that if we manage to close the women's health gap, we unlock $1 trillion annually as global GDP by 2040. And this equals an expanded workforce participation. Remember the women's graph, with the years being around their working time. So this equals to a 137 million women working full-time. And this is only the working full-time women. We don't talk about the women who can re-enter workforce and work part-time. So we just have to imagine and understand these numbers. With a return on investment for every $1 being invested, you get $3 in return of economic growth. So women's health is just not only about women. It's a global economical power. We need to realize that. So let's get back to my subject, cardiology. Everybody who studied medicine probably knows this picture from Netta Anatomy. And when I was studying, this was what cardiology was about. So an elderly man walking out of a restaurant in the cold, ripping at his left chest, like suffering from angina pectoris or myocardial ischemia. So this is what I studied when I was studying medicine. So what we know now is that women's symptoms differ dramatically. And this is a chart by the AHA, and you can also see here, Erika Sander just presented Go Red Austria. So this is from the original Go Red campaign in the US. That's where they started. You can see that the symptoms that a woman can have can be also the symptoms that a man has, but you can also have fainting, indigestion, extreme fatigue. You can have rather upper back pain or lower chest, upper abdomen pain. It's very cryptic and very diffuse, but we need to be aware of that. Women need to be aware of that, and healthcare professionals in society as well. Women need to be risk evaluated differently than men. And this is still not implemented in national and international risk scores. So women have, due to their hormonal system, sex-specific risks around reproductive and pregnancy-related factors, factors. We know every woman with pregnancy complications, such as preeclampsia, such as gestational hypertension and diabetes, that poses a really, really elevated cardiovascular risk during the next upcoming 20 or 30 years during the lifetime of a woman. Preterm birth, pregnancy loss, stillbirth poses cardiovascular risks. All hormonal factors, onset of menstruation at a very young age, onset of menopause at a very young age, poses risk factors, PMOS, endometriosis, as well as psychosocial factors. We know stress is actually to be defined as a sex-specific risk factor because it affects women more and more out of proportion, and also a lot more intense because women have more cardiovascular disease if they carry a lot of stress due to caregiving burden or other diseases or settles. And the other thing is, the traditional risk factors that we have also have to be taken into account. All the risk factors that we all know about, they hit harder on women. Arterial hypertension, even at lower blood pressure thresholds, we have a higher risk of stroke and cardiovascular disease in women when compared to men. Diabetes, women with diabetes have a higher relative risk of coronary artery disease than men. And smoking also hits women harder. So I tell my patients all the time, know your risk. So let's get now to the nicer part. So what can we actually do to benefit? And this is a cohort study which came out 2 years ago, which addressed 400,000 participants. Mean age was 44, 55% women, and looked at how exercise can benefit them. We already had it before. Exercise is the longevity level that we have. And interestingly, women bring greater cardiovascular benefit than men even at lower exercise doses. So in this study, women could lower their all-cause mortality up to 25% with moderate exercise, men achieved 50% reduction, and it was sufficient to actually exercise moderate to vigorously at 140 minutes per week. Men required the double amount that the WHO recommends per week. And also strength training. Women benefit enormously from a cardiovascular perspective from actually really strength training. It's not about osteoporosis prophylaxis. That also comes also in along. So it's more important really to exercise as a woman. And the next study, which came out last year from the Global Cardiovascular Risk Consortium, actually took a look at the global effects of the traditional cardiovascular risks on lifetime estimates. And it said that hypertension, diabetes, smoking, dyslipidemia account for more than 70% of lifetime cardiovascular risk globally. And if we manage to actually control, the best case is to have no risk factors at the age of 50, but if we manage to actually control them well enough at the age of 50, we gain more than a decade of additional life. Women benefited a bit more with 13 more years of life, and this is life in good health, being free of cardiovascular diseases, and man gains 10 more years. So it's never too late to actually address those risk factors. And also politically, the European Union is addressing this need at the moment with the EU Safe Hearts Plan, which was introduced in last year in December. And it aims to actually reduce this enormous burden and also has women's heart health as a critical priority. We have a rising burden of cardiovascular disease, and if we don't do anything by 2050, it will be projected to rise to more than 90%. And the target will be to reduce it by 25% by 2035, implementing national plans. So my call to action is to finally understand that the gender health gap is not just a woman's issue. It's a structural barrier that limits the quality of life for all genders. And we need to transform the future of women's health by actually recognizing the unique biology that women have, closing diagnostic and research gaps, empowering women to understand their risk, as I said, know your risk, building a healthcare system that finally reflects half of humanity, and seeing prevention as the most powerful longevity intervention that we have. So I started with a quote of a brilliant woman. I'm going to end with a quote of a brilliant man. Everybody knows him, Johann Wolfgang von Goethe, who said, "Knowing is not enough, we must apply. Willing is not enough, we must do." So I really, really hope that everybody, we're so motivated that we will get this problem done. will close that gap. Thank you.